Good evening, everybody. I am Gregory Zarian.
And I'm Susanne Whatley. Welcome to HEALTHline. You know, it takes a village to raise a child.
Okay, and I just want to say that I have the village in my car because I'm not growing up, and I'm not okay with the theme of this show, but I will work through it.
The theme of the show is living well in your senior years.
And it takes a village to take care of our seniors.
It does, and this community has so many wonderful resources to offer our senior citizens, and we're going to be having as a guest on our show a doctor who specializes in their care, a person who works for Glendale Adventist Medical Center who is putting on a program specifically designed to help seniors navigate the hospital system, and also a woman who trains other people and also personally does it herself, conducts a car fit program that helps senior citizens drive more safely on the road.
Well, I think also other people besides seniors need to take that car fit program, because let's just talk about how bad the driving is, but that is not the topic of tonight's show.
No. First, we're going to introduce you to Dr. Jack Yu. He's the physician specializing in geriatric medicine. Welcome back, Dr. Yu. Happy to have you back on our show.
It's my pleasure.
Tell our viewers about your practice here in Glendale.
Well, I do see patients, elderly and older patients, in the office, in the hospital, in nursing homes, and occasionally in the home as well.
Now, Dr. Yu, what out of the gate, what is the most important message you just want to pass on to seniors?
Well, it's your health, your body, your life. So live it to the fullest. And the other thing that goes with that is use it or lose it.
Okay, I'm going to redirect that to the camera. Okay, did you hear Dr. Yu? It's your health, your body, your life. You got that. I said it twice after Dr. Yu, so you can write that down. And if you don't use it, you lose it, which I love.
Talk a bit about that. What do you mean?
Well, my mother, for example, will say, you know, I can't do these things anymore because I'm old. I need to slow down. Well, that's not really true. If you slow down, you will get weaker and more tired. But if you keep trying to go to the edge, keep exercising, keep doing those mind exercises, go to the gym, work out, lift weights, you can preserve a lot of that.
Because getting old is just actually a state of mind as well.
A lot of it is, exactly.
Okay, well, don't go away, because as we age gracefully into the next segment, we're going to spend some more time talking about taking care of our seniors right here in Glendale. And I'm going to say it, and spend more time talking about the golden years. Don't go away.
Hello, I'm Dr. Jack Yu. I work at Glendale Adventist Medical Center. I'm here to give you a health tip on aging gracefully. The American population is getting older, and there are more of us that are getting older. So in order to live gracefully, we need to do a few things. Exercise, keep active. Nutrition, eat right, don't be overweight, eat the right things. And being a nice person, working with your family, having a purpose in life, being in your faith community. This is Dr. Jack Yu, a health tip from Glendale Adventist Medical Center.
When is time your enemy? When a stroke first occurs. It is critical to know the symptoms of stroke. Vision change, loss of balance, dizziness, weakness or paralysis, difficulty speaking or understanding speech. Your best chance for a full recovery requires immediate medical care. That's why Glendale Adventist has a state-of-the-art stroke center dedicated to the best and fastest treatment. Because with stroke, time loss is brain loss. Glendale Adventist Medical Center. Healthcare at a higher level.
Running is life to me. It clears my head. A day is not complete unless I've gone for a run. So when my knee started to ache, I didn't know what to do. My physician referred me to the Therapy and Wellness Center at Glendale Adventist. My physical therapist quickly assessed the problem. We worked together to strengthen my knee and fix what was wrong. Now I feel stronger than ever. Thanks to the staff at Glendale Adventist Therapy and Wellness Center, I feel more like myself again.
Here on HEALTHline, we're talking tonight about the various services that are available to our seniors in the greater Glendale area. Geriatric medicine specialist Dr. Yu is our first guest. Dr. Yu, talk about some of the main issues that are facing seniors these days in the area.
Okay, well, you're talking to a doctor, so I think about health. So the main two things are financial health, especially these days, and then medical health.
Right.
But then, doctor, if financial health is not great, that really affects the physical and the mental health
They
as
are
well.
related.
So if a family member is suffering from so much financial disability, what do you say to them to actually don't succumb to that and take care of yourself mentally and physically? How do you prescribe that to them, even though they're so lost in their depression of not having the finances?
Well, sometimes it's depression. A lot of it is that it's actually been documented that seniors will look at their medicines, they go to the pharmacy, and the pharmacist tells them how much they cost, and they say, I can't afford that. They don't tell their doctor. The doctor thinks they're taking the medicine, but they're not.
But aren't most seniors covered under Medicare?
Many seniors are, but many of the medications we give them may not be covered. And Medicare, like everything else, has limits. Even Part D has limits.
I have to ask you though, I was just reading Clark Howard, who is a consumer specialist, is out with a new book where he states specifically a lot of times doctors don't know how much a prescription is when they actually hand that little piece of paper to their patient. Is that true?
That really is true. And I hate to pick on my other colleagues, but many of the doctors, especially the specialists like cardiologists and maybe surgeons, they don't pay attention to it as much. I also train doctors, and I really drilled into them, know how much these things cost, because they cost a lot.
So if you're not going to pick on them, I'll tell you who he's talking about. Just kidding. Doctor, so most people that are in their golden years that can't afford their prescriptions really won't go get a prescription because they can't pay for it?
They'll get the prescription, but they won't fill it.
Really? Mm-hmm. And how does that follow then that follows into the mental and then of course the physical?
That's correct.
That's right. They're not being treated for their ailments, or they're cutting their. What about like cutting their pills in half?
That's a great
trying
idea.
to make it go farther.
It's a great idea.
Clark Howard recommends getting a higher dosage within each pill, like 100 milligrams instead of 50, and then getting a pill cutter and cutting it in half.
Doctor, do you feel that people, seniors, start taking care of themselves far too late?
A lot of times they do. We really believe in prevention and screening. So preventing disease and also screening for early disease like cancers and heart disease, things like that.
But going back to, you said your mom was saying, oh, I'm too old, I can't do this. Do you find that most people have, well, first of all, when you say geriatric or seniors, what age are we talking about?
Usually 65 or older, but I have younger patients too.
Yeah, and they're considered seniors?
They can be.
Is it a mental thought?
Well, not so much. There's aging. Everybody's going to get older. We can't stop that. But not everyone will have diseases. It's when you get older and you have diseases that we have problems.
And what's the biggest challenge to our seniors in terms of maintaining an independent lifestyle, like staying in their home?
Well, I think it's mobility. So it's being able to get around your neighborhood, being able to get around your house. You can't go to the store and shop, you can't go to the doctor, then it's really hard. But if you can get help, then that may be possible. And then in your own house or your own apartment, can you get around? Can you get to the bathroom? Can you prepare your food? Can you get around and pick up things?
And take care of yourself.
Let's take a look at one of the great features of the city of Glendale, the new Adult Recreation Center on East Colorado that just went under a beautiful remodel.